Well, thank you again, Paul, and thanks to everybody. Welcome, ladies and gentlemen, to our daily briefing. Let me just start by saying we continue our efforts to see what we can do to drive down the transmission rates. I know this is repetitious, but again, something we all need to understand and encourage ourselves to change our behaviors accordingly. We have new numbers. You'll hear from Dr. Dunn today on our transmission rates and infection rate that's taking place. The numbers are encouraging. We are making some headway to slow the spread, and I feel good about what we're learning. We hope that trend continues. It's too soon to tell, but again, the new numbers coming out today gives us some hope that we're slowing the increased percentage rate at least down. Again, the motivation for all this is the key issue for us is to make sure we do not overwhelm the healthcare system. We have limited numbers of beds, finite number of beds and equipment. And so if we can keep this slow down, we'll make it so that the healthcare system can accommodate those who need healthcare. And that's a key to making sure we have less fatalities and less serious illness. Now, the next 2 weeks, as I mentioned, and I'll mention it again, and I'll probably mention it again tomorrow, the next 2 weeks are critical. That we, in fact, obey the directives we've given as far as stay home, stay safe. The home is the best place for you to be. Again, I know this is a time of travel. Again, with the weekend coming up, we have spring breaks, we have conference, we have sunshine coming in the spring, so there's a tendency, certainly historically and culturally, to travel. We need you to restrict that travel to just essential travel. I know that's a sacrifice, but it's a needful sacrifice if we're going to slow the spread of this coronavirus and keep ourselves safe. Again, the typical common sense things of keeping your physical distance to at least 6 feet, as we call social distancing. Hygiene efforts to wash your hands often with hot water, sing happy birthday to yourself twice. That'll get you through the 20-second time mandate. Cover your mouth and your coughs and sneezes, and use your elbow. Better to have maybe a hanky with you to cough into, and that would be a better situation. We certainly want to remind those who are at risk, the at-risk groups, which is anybody 60 years of age or over, and particularly those who may have an underlying health care need, an issue with the respiratory issues, diabetic, those kinds of things. So older, those with underlying health care systems, need to be extra cautious. The data does show us that if you are older and you get the COVID-19 virus, you're probably more susceptible to more severe reaction and even death. So again, for those senior citizens over 60, make sure you're extra vigilant and take appropriate steps, again, of staying home, being extra cautious. And again, I'll just conclude by saying we all need to do our part. Everybody has a role to play. Let's try not to bend the rules. Let's try to follow the rules of our stay safe, stay home directive that we've issued statewide. Local communities have some even more stricter rules in place. But again, the spirit of what we're trying to do is to make sure that we, in fact, do what we need to do by staying safe and have less contact. With that, let me just mention and transition into just a word about the economy. I know our number one priority is to make sure that people's health is taken care of, that they're safe, but we are concerned about the economic well-being of our state also. That's a challenge. We know it's a worrisome thing for people that are faced with maybe losing their job, loss of opportunity to have revenue to pay their bills. And there's nothing probably more devastating than the threat of loss of job or the actual loss of a job. And as I look at the unemployment numbers that just came out this morning, the news is pretty grim. And let me just put it in context. We've had more unemployment claims in the last 2 weeks than we've had in the entire year of 2019. We've had just a very sharp escalation of claims as people are losing their jobs or put on furloughs and leaving the employment force for a period of time of who knows how long. So again, the extra fear that comes with is acute. We certainly care about the economy. We want people to stay engaged in the economy as they're able. There are safe practices that you can do, and we encourage our employers to make sure that they have a safe environment for their employees to come and participate and work in. A lot of companies are telecommuting more and more. We have the technology to do that and still be effective. We've asked everybody to take the Triple T challenge for our restaurants. Again, take out at least 3 times a week, an opportunity to not have to cook and help stabilize and keep our restaurants and our fast food operations in business. Again, this is just trying to get us through this gap that we have right now as we go through this coronavirus issue. The CARES Act, again, I mentioned help is on the way. The federal government has passed laws and a $2.2 trillion appropriation. It's not up yet, ready to go to the access, but it's coming soon. So again, the CARES Act not yet available, but it's going to help employers, help businesses, it's going to help employees. For those right now, in the meantime, please go to jobs.utah.gov, jobs.utah.gov to apply for help. There are people that are ready to help you in whatever your situation may be, help you get unemployment insurance and stipend that come in and can help you weather the storm. For those who maybe need retooling, new education training to get better job opportunities, that's available too to help give you some direction there. And we're going to be working, I've talked to the banks again today, we have some opportunities with SBA loans, the federal government, for businesses to access very low cost loans, as low as 0.5%. 0.5% of loans over a couple of year period of time, and very good opportunities for small businesses in particular to stay afloat with the help of some of this money. If you have a need, please go to see our Department of Workforce Services. Again, I mentioned jobs.utah.gov. We encourage you to do it online. That's quicker than queuing up and getting on a telephone, which sometimes can be a long wait. So jobs.utah.gov, our Department of Workforce Services here is there to help you. Now, what we're here to talk about also today, which I think is very encouraging, as you all know, throughout this crisis, one of the biggest obstacles and hurdles we've had to overcome is the lack of testing. Not unique to Utah, it's throughout the country in every state. We've been working 24/7 around the clock to see if we can, in fact, find ways to, in fact, improve testing. I appreciate the fact that in many ways and areas out there, we've seen the private sector step up and help us find materials for personal protection equipment, help us with masks, ventilators, a lot of different things that are taking place in the private sector to help augment what the government is doing. As part of our urgent phase in responding to COVID-19, this testing issue has been a real challenge. But guess what? We have had a breakthrough here today that I'm going to announce. Let me thank all the healthcare providers that are out there for what they've been doing, whether it be the University of Utah, ARUP, Intermountain Healthcare, our own state labs, all working hard to produce additional testing opportunities to find out who has the COVID-19 and help us to isolate, track, and trace those that they've been exposed to. So we're grateful for the work that's been done, and Dr. Dunn will be here, as I mentioned, in a few minutes to give you some additional information on the latest stats. But today we have an important announcement, an important development on the testing front. Through our task force, chaired by our able Lieutenant Governor Spencer Cox, and working with some of my friends in Silicon Slopes, they've come together in what we would call a public-private partnership. These entrepreneurs have stepped forward and said, we can help. And they're driven. They've been 24/7 around the clock for the last couple of weeks in trying to get to this point, which we're announcing here today. And not only did they say we're going to try, but they said we're going to do. And here to explain what they have done and what it's going to do to increase our testing opportunities in a very significant way. This is really one of the first of its kind public-private partnership. It's going to help us accelerate testing for the COVID-19 in Utah. Again, you know our goal is to get to 7,000 a day. We're not there. This is going to be a major step today and help us achieve that goal. So I'm joined by representatives of our high-tech center, high-tech sector, we fondly refer to as Silicon Slopes. And I know they've been introduced already, but as I introduce them, I'm going to ask them to come in. Lieutenant Governor Cox, who's in the back of the room here, having Clint Benson, who's the Executive Director of Silicon Slopes, Josh James, who's the CEO and founder of Domo. Keep your social distance. Josh James, founder of Domo. Ryan Smith, who's the CEO and co-founder of Qualtrics. We have with us Josh Walker, who's co-founder of Nomi Health. And we have Dave Elkington. I'm going to ask Dave if you'll come to the podium and kind of explain what's going on here, the founder and chairman of InsideSales.com. We have Kristen Cox, who's been really, along with Lieutenant Governor Spencer Cox, who has been a go-between with the government and these great entrepreneurs in developing what you're going to hear announced here. So David, we'll turn the podium to you.
Thank you. Thank you, Governor. And to start off, thanks to all of the people who have been working tirelessly, especially those in the hospitals, in the front line trying to help with this. Today, we're super excited to announce what we're calling the Utah Crush the Curve campaign. We believe if we come together as a private group of companies, as a public organization, as individuals in the community, we think we can get ahead of this, and we can not just flatten the curve, we think we can crush the curve. And to us, there's a three-part campaign to this. Number one, we think we need to assess everybody in the state. So one of the things we're announcing is the largest health assessment ever done in the state of Utah, and that's going out today. Number two, and before we move on to number two, the reason is we can't get ahead of this if we don't understand this. If we don't understand who's sick and where they're at and what their symptoms are, we can't get ahead of this. So the purpose of the assessment is to help us understand where the problems are, where we should set up more testing, how we collaborate. So number two, we're setting up is testing. We're setting up in a partnership with the state of Utah, with one of the prominent hospitals in Utah, and with an armada of volunteers and companies and partners and the state and the governor and the lieutenant governor, and especially Chris Cox here, who is representing our partnership and the relationship as we interface and liaison with the governor and with the other health organizations like IHC and ARUP and the state lab and the state health department. We're setting up, to accomplish the increased testing, we are setting up mobile testing stations throughout Utah. We have two already. So there's one in Orem at a hospital there. There's one in South Provo. This is just the beginning. We're treating this like a startup. So what you're seeing is you see founders, you see entrepreneurs here. We're treating this like a brand new company and a brand new startup. So we don't have 12 tents yet. We have 2, and we're thinking about any sort of supply chain as we get enough capacity in a lab. So we've partnered with a hospital. So as we've driven increased capacity in a lab, we then set up additional tents. As we get more inventory of tests and we get more capacity in the lab, we'll add more tents. We hope to have tents from north to all the way from the north all the way down to the south. Our objective is to create ubiquitous testing for anybody who has symptoms and who needs it. We believe this will really dramatically decrease the fear that's in the state, because one of the things that's crippling is we're hiding in our homes. We're not working. We're not spending time with families. And so if we understand if we're sick or if we're not sick, and if we are, how to address that, which is number 3 in this campaign. It's tracing. Once we know if one of us are sick, we can then isolate, as the governor described, and then we can then identify where we've interacted and be able to prevent spread of the virus. So for us, it's a 1, 2, 3 campaign. Testing, assessment number 1, testing number 2, tracing number 3. We have, just to be very specific, in the 2 locations, we have over 400 tests happening, or the capacity for those tests a day. We expect in the next 2 to 3 weeks to be able to get to as many as 4,000 tests a day. 4,000 tests a day. Now this is a startup, so if we don't, it's not because we didn't try. We're running as hard and as fast as we can. And if we can get to 5,000 tests, we're going to get to 5,000 tests. But this can only be done through this partnership with, again, private industry and public. Chris, so Chris has been our key person to help us understand their objectives. So share a little bit about why this partnership has been so important and what our partnership has been is meant to help the state and facilitate the partnership. Come over just like 3 weeks.
That's the trick as a blind person. I can't touch anything to figure out where I am. First of all, this partnership has just been remarkable. The governor has talked about throughout his whole career about partnerships, and this represents that piece. And it builds upon the amazing work of ARUP, the University of Utah, Intermountain Healthcare, our local health departments. So we're fortunate because it's starting from a very strong foundation, from the actions the governor and the lieutenant governor took proactively weeks ago, which has put us in a place where we can slow enough of the spread to ramp all of these other things up that are necessary to get ahead of this. We need to run faster than the spread of the virus. And there's a few key objectives in all this. As he said, we need to build the most aggressive, spot-on information portal we can get by sharing data across all the stakeholders so we know where the hot spots are, where we need to direct testing, where we need to become more aggressive with mobile test sites, and where we can even do random testing to see where the spread may be moving. That's critical, and we're working with a group of experts to help guide those decisions. We're working with our local health departments to make sure their tracing efforts, they have the staff and the support they need to undertake this enormous amount of work that is coming their way. And in all of this, when we get this information right, we can start identifying the people at risk to move them into testing. We have very good protocols that are being reviewed right now by experts to make sure these testing protocols are in place so that we identify people quickly. This is a game of speed and scale. We identify these people, we move them into testing, we get to them what they need as quickly as they can, and if they are positive, we move them aggressively into very solid treatment protocol and quarantine. Again, we have to capture this virus faster than it spreads. And we've been blessed to look at the lessons from other states, what to do and what not to do in other countries. Some of the best experts in the country live here in Utah, and we can access their expertise. And there is no, Derek Miller once said, this is a goal, there is no guarantee. But we believe, under the governor's direction, that we owe it to our citizens, to our employers, to our partners to do all we can to both protect public health and get the economy back on track as soon as we can so that we can avoid some of the devastating effects that's happening to businesses and individuals. So we're hopeful, we're optimistic, and we want to lead out in the country so that we can help our other states become successful as well.
Right. So Josh,
Yeah, any other comments,
I have
Josh?
a couple of comments, and so the thing I thought, this has been a project over the last month. I thought it would be useful for people to understand why this became such an important thing this is all of the tech communities in Utah coming together. This is frankly all of the businesses coming together. So I thought it'd be useful to hear from some of the business leaders who really drove a lot of this initiative. Josh?
Thank you, Governor, Dave, Chris. This is a trying time for sure. My heart's just been aching with all of the pain that we're seeing out there. I've got a really good friend here in Utah, and his son is very high risk, and he contracted the virus, and they're very, very worried for him. And seeing the pain that's across the globe and in hotspots in our country, on the one hand, it's debilitating. The pain and the suffering that we're all witnessing, it's debilitating. And my heart's just been breaking. On the other hand, it's like, it's time for us to step up. It's time for us as a state, it's time for us as a people to come together and to figure this out. And when I first started hearing about some leaders in our tech community saying, hey, I think we can augment the testing that's going on in the state. The first time I heard it, I was like, come on, that's not what we do. And then I had a phone call with Mark Newman, who had the idea to kind of go after this in the first place, down at Nomi Health, and his partner Josh is here. But I listened to him for an hour, and I was like, okay, this is actually doable. And it was just so great to see everyone come together. And I really want to actually take a moment to say how proud I am of having the leaders that we have, Governor Herbert and Lieutenant Governor. We called them, and without blinking, they said, we're all in. We'll help you however we can. We will bust down walls. We will talk to whatever CEOs of whatever organizations we need to make sure that they all know that we're supporting them. We're all in this together. And it's been really inspiring and heartwarming to see us all come together. And so I love the campaign, Crush the Curve. We can do that together as a state. You know, there's a lot of fodder out there about everyone stay home, don't get tested. Well, it's don't get tested when you don't have tests. When you have tests, it makes such a huge difference. I had a daughter in France, and she was around a bunch of people that were tested positive, and we had to get her tested, and it took almost a week to get the answers. And it was such a horrible, trying week. And the testing that we're doing here, we're getting answers often within 24 hours, and I think 48 hours is our SLA, so it's happening very quickly. And I'm just excited and proud of everyone everything that everyone is doing. We get on these calls, and there's literally hundreds of people on these calls trying to figure out however they can help. There's hundreds of people that made these tents go up. There's so many different components to come together to get a test. And I'm just so proud of the work that Chris Cox and the government has done in partnership with us, with the health providers that have been helping out, and just excited for all of us to band together and see what we can do to beat this invisible enemy. Thank you.
Yeah, I'm Ryan Smith. I'm the CEO and co-founder of Qualtrics. I just want to echo everyone else that this is a hard time. I think we've got true heroes in our community, the first responders, and anyone who's struggling with this. I'm super impressed and grateful to be in the state of Utah. You know, as we look at some of our colleagues in other states, they're getting pulled in to try to fix broken supply chains and come up with answers when it's too late. And you know, it's spreading in Utah, it's real, but we have a chance to do something right now and get ahead of it, and that's because our government cares. Our elected officials actually are trying to do the best they can and trying their hardest. And when we were approached, and we approached them, you know, in our case, to run an assessment that would be the largest that probably anyone's ever run on the healthcare side, the answer is yes, we're all in. And so we're happy to help. Watching the Utah community, you know, community's theoretical until you need it. And watching everyone come together has been so inspiring. It makes everyone want to just try harder. So as Dave said, this is a startup. It's young. The early results are incredible. I think people can draw the plot and see that we can really lead in testing, getting everyone test to understand what's going on and figure out how we can help solve it. But all the resources we have from our companies, all the funding that we can actually drive towards this, we're willing to do, because together we can get back on our feet. So thank you, Governor. Thank you, Chris, for championing this. And you know, let's all go through this together and figure out how we can help.
Thank you.
I want to echo what's already been said, and also just thank Lieutenant Governor Cox for all the leadership he's done, the Utah Coronavirus Task Force, you, Governor Herbert, for everything that you've done, IHC, University of Utah Health, ARUP, everyone who is putting so much effort and time into getting every Utahn tested who wants to be tested. That is the goal of testutah.com. I would encourage everyone to go to testutah.com. Today at 4 p.m., Silicon Slopes will be hosting a special town hall about testutah.com, and then every day Silicon Slopes will give an update live on what the results are on testutah.com and everything that's happening. So we want to be as transparent as possible. And just real quick, I want to thank the leadership of Dave Elkington for everything he's put into this. Mark Newman, the CEO of Nomi Health, Josh James, Ryan Smith, Josh Walker from Nomi Health, Jeremy Andrus from Traeger Grills, and the entire Silicon Slopes community for rallying around this problem and rallying during this time. So stay tuned. As has been mentioned, this is a startup. We're going to be very transparent. No tech company is going to make any money off of this. We're going to make sure of that. This partnership with the state of Utah is all about getting all Utahns tested. And so stay tuned at 4 p.m. Silicon Slopes will be doing that special town hall. Thank you very much.
It's been a wonderful opportunity. I need to echo Ryan's comments, which is community is theoretical until it's actually in front of you. And we've seen an incredible amount of individuals who have offered up their support and services to the ends of what they had to offer. We have seen the brightest people in the state. It's been great to leverage what the wealth of information, technology, the brightest minds that we have here to solve this problem. So thank you.
That's it.
Thanks, everyone. I know it feels like everything's been said, but not everyone has said it yet. And so I just want to put a bow on this and maybe highlight a couple points that are really important as we go into this. The first, the why behind what we're doing. We've talked about how important testing is, and I know it's kind of obvious, this idea that we need to know where the virus is so we know how we're doing. It's hard to make decisions without good data, and it's important to also know, I know we've talked about ARUP, the state lab, and IHC, but we are a top 10 state when it comes to testing per capita already, and yet we still have so far to go, which is why this partnership is so important. But it's even more than that. This idea of physical distancing or social distancing, we all know that there's only so long that we're going to be able to do this. We can't do this forever. This is really a sledgehammer approach. And it's important because we didn't have testing early on. The failure of testing in February and going into March with the bad tests that were sent out and having to start over and being behind the curve, which is why social distancing is so important. What the governor has said is critical over these next 2 weeks. None of what we're doing matters if we don't stay home and stay safe. So it's more important than ever that we social distance, that we physical distance. That's important. But the second piece of this is the scalpel approach. What we're really talking about is we're building capacity so that we don't have to live our lives in shelter all of the time, so that we can find those that have been infected and the people they've come in contact with, even if they don't have symptoms, so that we will eventually be able to test all of them. Now, I want to point out that what's happening today is a really, really big deal. This was mentioned, we only have 2 sites open in addition to the other sites with IHC and ARUP. Those 2 sites, one in Orem at Tim Hospital, and the second at the Provo Town Center, the Town Center Mall in Provo. Those are the 2 sites right now. There will be limited availability at those sites, but again, we have testing capacity in other places. Now, this assessment that was discussed is also very important. The assessment is important for 2 reasons. One, it helps citizens understand if they need to get tested. So this assessment is going to ask questions about your health. Are you having symptoms? And it walks through what those symptoms are. And at the end, it will say, hey, you should probably get tested. If you live, in these areas where you can get to one of these sites, you'll get a QR code and a time that you can go and get tested there. If you don't, it will point you to other locations with our other providers in the state where you can go and get tested. That's going to be very important. But the second piece is it will give our health department important data about where this is happening. One of the things we've seen in other places is that if this can spread in a concentrated area very, very quickly. We know that we have been under testing in some locations. Utah County is one of those counties that is under tested, which is why this is going to be so important. We know that places in southern Utah have been under tested, and we need to expand the testing there as rapidly as we possibly can. So those things are very important. Now, again, we want to get to the point where everybody can be tested. That's the ideal. We're still not there yet. If you're not having symptoms, you probably aren't going to get tested unless you've had direct contact with somebody in your family. But again, walking through this assessment will help you understand what you need to do and where you need to go to get tested. And then over the coming days and coming weeks, as these other sites are stood up, as we have supplies are still an issue. We're working through that with all of our providers to do more. But this is going to be a game changer for the state of Utah. And this is what makes Utah so very special. We mentioned this yesterday. People stepping up from the private sector, everybody can do something. Everybody's working to do something. And we appreciate Silicon Slopes for stepping up in a very, very, very big way. Now, I will also just say this, Tim. There are going to be some bumps along the road. We're doing things in the past couple weeks that should take 6 months to a year to do. So please be patient. If the website doesn't work exactly the way it's supposed to, just understand we're working on that. We're trying to fix these problems as they go. There will be bumps along the road. We're all working together. It's not often that we get the private sector involved in something like this. And so we're figuring out how to work those levers between government, nonprofit, the private sector, and of course our healthcare sector. So thanks for everyone. Remember, we're all in this together, and we're now ready for some questions, Governor.
Well, thank you, Spencer. Thanks to everybody that's been part of this program today. This does illustrate why Utah is such a great state. The ability for us to come together, to cooperate, to collaborate is the Utah way, and one of the secrets of our success. It's not lost on me that these 4 entrepreneurs who represent 4 major companies in our state probably have in their employ over 10,000 people. And yet they're coming here and giving their time and talent, resources to help us step up, as Josh mentioned, to see if we can't together conquer this challenge. So with that, we thank them for being here. We'll open up for questions for a few minutes before we bring in Dr. Dunn. Any questions out there?
Yes, so we have a question from Chris Reed. Chris,
I have a question regarding, I think first of all, I think it's a great initiative, crushing the curve, but my question is, how do we crush the curve when we're continuing to allow out-of-state visitors into the state that are potentially infected? Several states like Hawaii and Texas have instituted common sense quarantines, and we know for a fact that many of the cases up in Summit County are from people that came here on ski trips. So with all these initiatives that sound great and stuff, but we're leaving the window open for out-of-state potentially people to come in and infect, would bring clusters of the virus. It just seems that needs to be done, and I'd like to know why that hasn't been done, and if there are plans soon to initiate that.
We actually have done with our airport. Again, Hawaii is an island, so people fly into their airport. That's where people come in and they quarantine people, even if they're residents, for 14 days. We now are making sure that people at the airport come in and have to be tested when they get off the plane to make sure that they are not sick and they can be quarantined also. So we have, at least at our airport, we are reviewing what can be done at our other commercial airports in the state of Utah. For example, St. George, Cedar City, Provo, Ogden. Those are under review to do exactly what you're talking about doing. It's a little hard for us, so we've talked about having checkpoints on our freeways for people to come in. We have a difficult time with supply chains and the issues of bringing products into our state of Utah, but we're working with Utah to see if in fact checkpoints can be put in some rational and reasonable way as people come into our state. So at least the airports we're dealing with, highways and freeways we're talking about. Other questions?
Yes, now we will take a question from Chris Reed. Chris, you're on.
Thank you, Governor. And first off, concerning this testing is being announced today, and I've actually been to the site, and it's about 2-3 minutes to do the assessment. Obviously, the idea is to find those who need testing, but for those who don't need testing, how is this data going to be used?
So we talked about the campaign where there's 3 stages. There's the assessment, the test, and the trace. We can't really progress until we understand where the hot spots are and be able to identify people associated with it and then isolate and help prevent that. The data is critical in every one of those 3 stages. So we will know where to put up additional locations based off of the results of the assessment. So first of all, we're following the data. Second of all, the tracing is being collected from this data. Chris actually, I think, would probably share a little bit more to this. To your right.
There's a lot going on, and there'll be more information coming out in the days ahead. But using the survey, we're working with a team that will be going out to the field and doing large-scale testing, validation, and random sampling and pool testing. This is we're casting a big safety net right now, and that net will help us know where to start going deeper with more aggressive and more scalpel-like testing in those areas to know where these transmission networks may be emerging. We're working with a really great team up at the University of Utah who's helping to design the randomization and the large-scale testing that will supplement this. There will be other tools that will be coming online in the days ahead that we'll learn more about moving forward.
Thanks, Chris. Well, 2 other points. All of the data collected through this process is being uploaded into the state's database that Chris just described, and the federal database that is being required on a daily basis. So all of this data is going into both the state and the federal tracing efforts and tracking efforts. Yeah.
So again, Josh Walker, Ground Health. I think the question directly was around what are we doing with the data of the individuals that don't need to be tested. So the assessment is valuable in the sense of we need as much data as possible. If you spend any time mathematically, the more data you have, the richer and more specific your data can be, or your mathematical number. So in this case, with the disease, many of the brightest minds in the state are working on a number of specific numbers. The R0, which you've probably heard about, that needs data from not just those who need to be tested, but those who don't need to be tested. It also helps us identify in that population of those of us that are walking around that maybe carriers of the disease, but not that are asymptomatic. We need to know in that population how many of those people are indeed affected but don't know it. So that's why everybody needs a chance to take this. And this is quite frankly our chance as Utahns to rise up, right? To band together and to bask together in the success of really doing this as a community.
Let me address one thing, because there was an implied question there. None of the data, none of the personal information in that data is viewed by anybody in this organization. I don't have access to the data. When the campaign is done, we're going to delete and get rid of that data. So there's no privacy data that will be exposed. We're in HIPAA compliant systems. Everything is being passed to the state where that analysis is being done.
Other questions?
All right, we have a question from Sonia Hudson. Sonia, you're on.
Hi, I'm wondering if there is, or if you're expecting an increase in testing materials to go along with this. We had a press release that said this is going to, or that this is going towards doubling testing. The online questionnaire is great, but you need the infrastructure in order to actually do that increased testing. So can you just talk about what we're going to see in the coming week or two?
Yeah, so we've set up several unique separate supply chains to be able to make sure we have all of the materials. So there's things like swabs, testing material called reagent, and the test itself. And what we've done is we've actually open sourced this testing process, which is very different than what's done traditionally. So traditionally you get a device that is, think about it, that it's almost self-contained. It's great if you have all the supplies, but if you don't, you're kind of in trouble. So think about what happened in the 80s and 90s when all of a sudden the PC emerged and you could start switching out your video card, or you could plug in your own mouse. We've done the same thing to the testing process. So we have no single point of failure. We have redundancy in our supply chain. We have redundancy in every one of our stages. We have redundancy in the databases. So we've made it so that if we get any sort of chokehold or any sort of bottleneck, we just plug in the other vendor. Now, what this means is we're focusing on speed and focusing on saving lives, putting people back to work. It's costing us more because we're putting lots of redundancy in. But this whole process is now open source.
Any other question?
Yes, we have another question from Ben Winslow. Ben, you're on.
So if I understand what this basically is a website that allows people who may not be exhibiting symptoms to go and fill out a questionnaire, find out if there may be higher risk or not, and then essentially 2 new testing sites in the Utah County area for people to go then get tested. Do you believe this is going to overwhelm what's existing, and is this scientifically sound, like on par with what the hospitals are doing?
Let's have Dave and then Chris or Josh. You want to call him? Okay, Josh.
Yeah, so a couple things. So it's not just for people who aren't feeling well, or who are feeling well. It's for everybody. And so we would love people that aren't feeling well and people that are feeling well to take it. That gives us a leading indicator on the hotspots inside the state. If you look at where we are right now with capacity on the testing, phenomenal efforts have been put in place to do that with the existing institutions that are working very hard. But what this data allows us to do is look beyond that choke point in the flow to see what the bigger picture is. So we can be better prepared beyond the preparations that have already been made by the state to address and respond even more quickly to some of those needs.
One other point. It's an important question. So I spent 2-3 hours just at one of the tents in Orem, and the question is, it's two today. We're expecting to be at another 6 tents over the next couple of weeks. But as I sat at the tent, it kind of surprised me. It actually really saddened me. We saw a woman, she was probably in her mid-50s, come to get tested, and the assessment said, look, you based off of your feedback, you probably need to go to an ER. And so she said, well, I didn't want to go to an ER. I really just wanted to get tested. And so the nurse said, well, what are your symptoms? And she shared, she couldn't breathe very well. They took a temperature. She had a temperature of 102. She had chills. She was achy. She was sneezing. And the nurse, it was heartbreaking. Like, she was struggling. And the nurse said, look, let's get you to a hospital. Let's get you to the ER. These are people, and she shared, she's like, I didn't know if I should go. I've been in my basement. I don't want to overwhelm the hospital. I felt badly. I just wanted to get a test. What we're trying to do is we're trying to give people a way to have confidence, to know what should they do, how should they respond, how do they participate, and how do they get this addressed. As I sat there, we're sick. I probably watched 20 people come in who were very sick. I don't think, as Utahns, we necessarily know what to do. We're afraid, and so this purpose is to partner with the state and help provide more resources, more knowledge, and more information.
Ben, you asked about scientifically validated, et cetera. Just 2 points on that, and I think Josh can speak to this on the survey, but we are not medical experts, and so when it comes to testing protocol, who gets in first, what are the risk levels, how do you triage, that has been developed by groups of experts at the Department of Health. We're having those and have been reviewed by other consultants that we've brought in that are experts just in this field in epidemiology to review those test protocols in terms of how we triage and prioritize the testing. I think you can also speak to the fact the survey itself has been matrixed against those test protocols, so the information we get goes along those testing protocols as we look at risk levels. And finally, the survey itself, and again Josh can speak to this, has been reviewed and validated by people who are medical experts in this field to understand what kind of information needs to be pulled to understand what's going on out there. Again, it's a survey, it's not perfect, but it's a first step in getting statewide information that then we'll start going deeper on with other tools.
Chris, let me make one other point. The question is, who should go? We did a soft launch yesterday, so we didn't announce it. We just wanted to make sure we were working out the kinks. So we told a few friends, almost nobody. We had almost 5,000 people come to the site. We had, we performed 600 or 700 assessments. We performed, I think, 80 or 90 actual tests. And this was just organic. So there's lots of interest and there's a lot of work in the state right now. So we want to help with that.
Let me just sum up here, and we'll have Dr. Dunn come in. I think what Dave Elkington just told us here, and I think everybody would echo, we tend to get bogged down in statistics. As Josh talked about earlier, about his own personal relationship with his son or daughter, I think it was. This is about people. These are our neighbors, these are our loved ones, these are friends, these are people we don't know, but we still care about. And this is going to allow us to, in fact, drive people, facilitate opportunities for people, in fact, to get an assessment of their own health. It's not just a matter of finding those that have COVID-19, it's finding out those who don't have it. And if you get that database in there, it helps us to isolate and track and trace, which is going to help us slow down and stop the spread of COVID-19. So let's make sure we remember this is about people we're talking about. I thank those entrepreneurs here, the business interests that have stepped up and said we can find a better way in collaboration with the state, those who are doing so much of the good work. We're looking forward to great things. Just the raw numbers of each one of these sites that are being rolled out, there's 2 of them now, another 6 to come. Of each one of them, they anticipate we'll be able to do 500 tests a day. So that's 3,000 additional tests, maybe up to 4,000, they hope, additional tests per day, which is going to help us get to that goal we had originally here, starting the first of the week, of 7,000. So this is a big boost, a shot in the arm to help us get to that, where we can really start turning the curve, bend the curve, and this effort to bend the curve is really going to, I think, have fruition. So thanks to one and all. We'll now invite Dr. Dunn to come in and give us the statistics, remembering, of course, this is about people.
All right, good afternoon. I'm Dr. Angela Dunn, the state epidemiologist for the Utah Department of Health. I'm here to update you on some numbers for the day. So we have 1,074 cases of COVID-19 in Utah. That is an increase of 62 cases from yesterday. We are cautious about drawing any conclusions from this number because we also noticed a decrease in lab results reported yesterday. We had 910 COVID-19 labs results reported yesterday. And this could represent a decrease in demand from the weekend because we do have about a 2 or 3 day lag in our negative tests coming in. We'd also like to note that we have changed the way our dashboard looks online. So we're now showing hospitalizations per local health district instead of visitors per local health district, because this is a more informative data point at this point in the investigation. However, we are still identifying any visitors to Utah who test positive for COVID-19 and conducting a full public health investigation, including isolation and quarantine for those persons as well. So with that, I will take questions.
Can you repeat the total number of tests that have been completed? You said they increased.
Oh, I'm sorry, sure. Thank you. The total test completed thus far is 21,065 COVID-19 tests in Utah. Thanks, Joe.
Just waiting to see if anyone has some questions. I think we have a question from Liesl Nielsen. Liesl, you're on.
Can you hear me?
Yeah.
Okay, perfect. Sorry, this actually might go back to Silicon Slopes Initiative 2 to increase testing. From what I've heard, in the next coming weeks, we should hope to have a total of about 8 testing facilities or tents. Is that the total number that's hoped for, or is there an ultimate but realistic goal for that?
That's what I heard as well. I think our goal is to get 8 additional testing sites up and running, but those efforts are underway. So we're currently at 2 and seeking to develop more.
Okay, but no plans beyond the 6 more that have been mentioned?
As part of the Silicon Slopes Initiative, I'm not sure exactly the plans beyond that.
Okay, thank you.
All right, our next question is from Ben Winslow. Ben, you're on.
Yeah, Dr. Dunn, what are your thoughts on this Silicon Slopes testing initiative? Is it reliable? Do you trust it?
Sure. So we know that a huge part of solving this pandemic here in Utah is to identify people with COVID-19. So any initiative that allows us to identify more positive COVID-19 cases allows us to do better public health initiatives, such as contact tracing, investigation, isolation, and quarantine. So this effort is part of that and will allow us to do public health initiatives better and more broadly.
Great. Our next question is from Nate Carlisle. Nate, you're on.
Thank you, Dr. Dunn. So can you clarify, I don't have any symptoms. Do you want me to fill out this website and if it tells me go get tested, do you want me to go get tested?
Sure. So for public health specifically, we're recommending that anyone who feels like they should, anyone that has symptoms consistent with COVID-19, they can take this survey or reach out to their healthcare provider to be assessed for COVID-19 testing. So if you are symptomatic, we definitely recommend seeking out testing for COVID-19.
Our next question is from Isaac Stewart. Isaac, you're on.
Dr. Dunn, a question about restaurant workers. This scenario exists where you could have an employee that has the coronavirus but is asymptomatic, handing out coffee or food to all the customers, and in doing so infecting them. Has that been thought about, and is there any mitigation efforts for maybe along the lines of prioritizing some of those employees to be tested?
Sure, so there is evidence now that pre-symptomatic or asymptomatic spread is possible prior to someone developing symptoms. And because of that, these social distancing recommendations that I've put into place throughout Utah are essential to stopping the pandemic here in Utah. So the restaurant order that went into place yesterday will certainly help with that, in addition to individuals using good hand hygiene and social distancing measures will prevent the spread of COVID-19. We don't have currently any recommendations for prioritizing restaurant workers in terms of testing or interventions at this point, because there's no evidence that that is a driver in our increase in numbers of cases here in Utah. But we're constantly evaluating the data to determine what the interventions should be moving forward, and that's something that we'll look at.
Our next question is from Jacob Hoppenstein. Jacob, you're on.
Hi, Dr. Dunn. I was wondering if you could clarify. You said that the cases increased by 62. However, the latest information page on coronavirus.utah.gov says 84. I assume that you're just no longer factoring in those 22 series. Is that correct?
Absolutely. Yep, that's exactly right. And so our case count did increase by less people than we usually have seen, and that we are not any longer counting visitors in our total case count. So that's part of it. Thank you for the clarification.
We have a follow-up question from Carlisle. Nate, you're on.
Thank you. Sorry, Dr. Dunn. Follow up my question a moment ago. What about healthy people, though? I mean, do you want them going to this website, and if the website tells a person with no symptoms to go get a test, do you actually want that person going to get a test?
So people who don't have any symptoms should definitely go to the website and they can fill it out and follow the recommendations that the survey leads them to. At this point, I don't believe the logic requests asymptomatic people to get tested.
We have a written-in question from Emily Means. She would like you to talk more about symptoms. We're seeing a greater variety of symptoms now, including headache, sore throat, more than just fever, dry cough, and shortness of breath. Should people with any symptoms get tested?
Yeah, so we have seen in the data and cases coming out of the rest of the U.S. and other countries that there could be broader criteria for symptoms associated with COVID-19. So traditionally, we've been looking at fever, cough, shortness of breath. There has been data that shows that sore throat, sneezing, headache, fatigue, general body aches could be associated with COVID-19 as well. So we do recommend that people with even those broader set of symptoms seek out advice from their healthcare provider and get tested if that's appropriate.
Our next question is from Michael Locklear. Michael, you're on.
Hey there, I have a question about the asymptomatic folks. What is your level of concern about the people who don't have any symptoms? And what are you saying about the potential about wearing masks in public? Because we're starting to hear at the federal level some potential wavering on the guideline that nobody wear any masks.
Yeah, so first the point about asymptomatic spread. As we learn more about COVID-19 in this pandemic, we are seeing that asymptomatic spread is likely for COVID-19. And this is even more important, this is reason for even more importantly following these social distancing recommendations that have been put forth by Governor Herbert. The best way to prevent asymptomatic spread of the disease is to be exposed to as few people as possible, and that's exactly what social distancing recommendations do. There are discussions at the federal level to consider whether the general public should be wearing surgical masks to prevent asymptomatic spread. Currently, we are predicting a shortage in surgical masks for healthcare providers, So there are conversations ongoing whether the benefit to the public outweighs, the risk of potentially having shortages for our healthcare workers. And I know there's also conversations going on about what materials would be best and most effective if people wanted to make their own masks at home. All of those things need to be studied, and guidelines should be provided by our national and federal partners so that people have the best information moving forward and don't have a false sense of security about the benefit of masks and homemade masks.
Our next question is from Garna Miha. Garna, you're on.
Thank you guys. Can you hear me?
Yes.
Oh, good. Okay. So I just wanted to really quickly follow up with this new Utah Test Challenge website. Obviously, we saw that it has that symptom tracker and whatnot. Is that different from the state's coronavirus task force? So we know that that has a wealth of information, but is there some sort of symptom tracker already to be in place? Two, where is it that you want people to go as their first resource? Is this just another option for them, or is it going to be linked up to the coronavirus website? And then three, are you doing anything in terms of Indian health country or Indian country with this and with testing?
Sure. So with regards to the testutah.com website and our coronavirus.utah.gov website, both of those are partnerships. So the state of Utah partnered very closely with our Silicon Slopes partners to create the testutah.com website. So it is in alignment and it was a partnership in order to move that forward. So I'm not sure on whether it's going to be advertised on the coronavirus.utah.gov website or not, but it was a close collaboration. Your other question on how we're working with our tribes. So at the Utah Department of Health, we have a tribal health liaison that always works with our tribes on health-related issues, and she is very involved with our public health interventions and our unified command in order to ensure that we're meeting the needs of our tribal Indian and urban Indian population as well.
Thank you.
All right, our last question is a written-in question from Michael Orton, and his question is, what is the most encouraging development on this front that you have accessed via all of your resources internationally or nationally?
Can you repeat that?
Yes. What is the most encouraging development on this front that you have accessed via all of your resources internationally or nationally?
So I'm not sure if they're talking about specifically like the testutah.gov collaborative or kind of in general. So there's a lot of encouraging data coming out of Utah in terms of the numbers of people we're testing versus the positives that we've been identifying. So we have increased our testing capacity dramatically in Utah, which has allowed us to really identify the true burden of disease throughout Utah, and that's helped us allocate resources effectively. And the testutah.com initiative will allow us to do that even better. So I think those are good things coming out of this initiative that will allow us to continue to do the good public work that we've been doing with regards to case identification, contact tracing, quarantine, and isolation. Okay, thank you guys so much.